Welcome to my case study presentation on the neurological condition called fibromyalgia. This is an overview of what I'll be discussing. Condition. Fibromyalgia is a chronic health problem characterized by persistent pain in the soft tissues surrounding muscles, joints, ligaments, and/or tendons. It commonly presents as muscle pain, fatigue, and multiple tender points on the body. It is considered to be a neurological condition because a change happens to an individual's neural signaling pathways, causing their perception of pain to become heightened. Their symptoms can improve or worsen from time to time, and this continues for months, even up to years. Case study. MH is a 55-year-old woman who is a bank manager and was diagnosed with fibromyalgia 6 months ago. She has been on short-term disability for the past 3 months, and she has experienced constant pain throughout her body that varies in intensity over the past 3 years. She is married and has 2 teenagers. She reports that she is always tired and yet is unable to get a good night's sleep after sleeping for more than 8 hours each night. She used to be very active. After having kids, she has not been as active and has become slightly overweight. So now we'll go into the details about the pathophysiology of fibromyalgia. For the next few minutes, I'm going to discuss what happens in the brain of an individual with fibromyalgia. The exact pathophysiology of fibromyalgia is unclear. We know that normal pain processing involves 2 neural pathways, an ascending pathway and a descending pathway. The ascending pathway I'll be representing in the color red, and the descending pathway will be in blue. The ascending pathway involves our peripheral nerves that transmit nociceptive signals to the spinal cord and up to the brain for processing. So, for example, if I apply a point of pressure onto the skin, that information is going to be sent through the spinal cord and up to the brain, where the brain is going to think, what was that pressure and how am I going to react to it? Now, in the descending pathway, we have inhibitory pain signals that are sent down from the brain to the spinal cord and out to our periphery. So that information is going to tell us whether we feel increased or decreased pain. So, ow, that hurt so much, or that wasn't too bad. For fibromyalgia patients, there is a change in these ascending and descending pain signaling pathways that cause a hyperactive detection of pain, and it has to do with the imbalance of some important neurotransmitters. The first neurotransmitter we're going to talk about is glutamate, which is involved in the ascending pathway. So I'm going to write it right here in red. Research shows that fibromyalgia patients show that they have abnormally high levels of glutamate in a part of their brain called the insula or the insular cortex. So because glutamate is present in abnormally high levels, I'm going to put an arrow here to show, to represent that. Researchers went looking here because the insula is very involved in pain and sensory perception. Glutamate works to excite our sensory tract, and in the process, it increases the transmission of pain signals. So I'm also going to put a little plus sign to show that glutamate is excitatory. The next chemical that is not in balance is GABA, and GABA is part of the descending pathway. Research shows that low levels of GABA are present in patients with fibromyalgia. The primary function of GABA is to inhibit and suppress the sensation of pain and anxiety. So GABA here is going to be inhibitory. It essentially works to calm your brain. So you can imagine that low levels of GABA means that we're no longer able to suppress pain and anxiety. The next few chemicals that we're going to talk about are serotonin, norepinephrine, and dopamine. These are considered to be our feel-good neurotransmitters. In order for us to feel good, they help to block our perception of pain. So they all work as inhibitory. They are present in low amounts in patients with fibromyalgia. I'm going to show the arrow here to show that they are decreased. So essentially, they are not available to block our pain reception as normal, and so our pain perception becomes heightened. The diagram that I've drawn here is thought to be the reason for why patients with fibromyalgia experience chronic and constant pain because of these altered levels of neurotransmitters. And I use the arrows here to represent whether there is an increase or a decrease in the certain neurotransmitter. As mentioned in the handout, some medications can be used to slow down the chemical impulses of the brain that heighten our perception of pain to restore some of this balance.
Now we can better understand a concept called central sensitization, which is the heightened perception of pain in the central nervous system. An individual becomes more sensitive to pain, oftentimes to the point where a light touch can be perceived as extremely painful. Now I made this graphic and hopefully it helps you understand how chronic pain occurs. It's the combination of that heightened perception of pain combined with blunted inhibitory pathways and the imbalance of neurotransmitters. Clinical features. Here are the key clinical features that fibromyalgia patients typically present with. Widespread pain is the core clinical feature of fibromyalgia, and that varies in intensity. Other common clinical features include fatigue, headache, sleep disturbances, morning stiffness, cognitive dysfunction, which includes trouble with memory, attentiveness, and concentration, as well as anxiety and depression. Tender points. These are spots on the body that cause immediate localized pain when firmly pressed. Common sites of tender points include the neck, shoulders, chest, elbows, hips, and knees. Clinical features in the case study. The first one is pain. MH has been experiencing constant pain throughout her body over the past 3 years. She rates it as a 6 out of 10 in her neck and shoulders, and this sometimes is accompanied by headaches. Tender points. MH scored 12 out of 18 on an examination for tender points. This means that out of 18 points on the body, 9 on the left side and 9 on the right side, she felt pain immediately when most of them were touched. Fatigue. She reports that she is always tired and yet is unable to get a good night's sleep. Cognitive dysfunction. She reports feeling foggy. The term fibrofog has been used to describe memory deficits, decreased concentration, feeling confused, and difficulties with rapid changes in thought. Activity limitations. MH experiences some difficulty functioning day to day and remains independent with her ADLs. However, her pain and her level of fatigue can change in intensity from one day to the next, making it difficult to perform self-care, productivity, and leisure activities. Because intensity of pain fluctuates, this could impact her ability to drive safely some days because she needs to be able to have unrestricted range of motion in her neck and shoulders to check mirrors and blind spots when operating a vehicle. The results of MH's tug test were concerning. She scored 25 seconds while using a single point cane. We know that older adults who take 12 seconds or more to complete the tug test are at higher risk of falling. This suggests some impairment, particularly some difficulty with balance and walking mobility, which would make it difficult and unsafe for MH to participate in most physical activities. As a wife and mother of 2 teenagers, we can assume she has her hands full with things to do with her kids, such as meal prep, driving them to and from school, and helping with homework. MH could be avoiding certain activities that are likely to cause increased pain and discomfort, such as working out. Her symptoms can make it difficult for her to perform even the simplest tasks at times, such as going to the grocery store. This could be a demanding task as she could experience persistent pain, fatigue, along with memory deficits and confusion as she tries to remember what groceries she needs. Participation restrictions. Fibromyalgia can have a destructive impact on one's ability to work and participate in everyday activities. MH has been on short-term disability from her occupation as a bank manager. Her condition makes her job responsibilities more challenging. Persistent pain causes her to be less productive at work, and as a bank manager, we can assume that she spends a lot of time working on the computer. Her bilateral neck and shoulder pain would prevent her from doing her job well and being able to be present for a full day of work. Fibromyalgia is very misunderstood and can be perceived as an imaginary condition. The symptoms experienced are downplayed because individuals may look well, but they could be in a lot of pain. MH is concerned that her coworkers think she's faking it, and this causes her to have some increased anxiety about being absent from work and having to explain why. MH struggles with planning social activities and committing to attend events in advance due to the unpredictable nature of pain and fatigue. She worries that her friends and family may stop inviting her because of this. I wanted to end on a more positive note with an inspirational quote that represents the strength, the reality, and the resiliency of individuals who have conditions involving chronic pain. It reads, "You just do it. You force yourself to get up. You force yourself to put one foot before the other. You refuse to let it get to you. You fight, you cry, you curse. Then you go about the business of living. That's how I've done it. There's no other way." By Elizabeth Taylor, who is a British actress, and she lives with chronic pain for most of her life. Thank you for watching.